A very good day, my dear undergraduate students. Welcome to a short class on the Down syndrome. The importance of this class is given in the enclosure. A short note, an MCQ, or a short case in pathology, pediatrics, medicine, or elsewhere. This picture is from Health Beat. A wonderful one, a photogenic, and it shows all the features of it. If you are a psychologist or a psychiatrist, you would very much appreciate the interest of the child in play. Occurs in 1 in 700 live births with increased incidence in the increased maternal age, in family history, and in monozygotic twins. It is an autosomal disorder. There is a translocation that occurs in chromosome 21. If there are other translocations in the mother, such as 1421 or 2121, there is a higher risk in the child developing a Downs. The clinical features, a wonderful picture which I would like you people to kindly appreciate. Obviously, there will be a growth failure and a mental retardation. Flattening of the occiput or the back of the head. Abnormal low set ears. There can be many loops in the fingers. At the same time, there is a single transverse palmar crease. There can be other congenital anomalies such as absence of a rib, intestinal blockage, weakness and flaccidity leading to an umbilical hernia, abnormality in the pelvis, and generally a muscle tone. One important finding can be the wide spacing between the big toe and the next. Megacolon is possible, congenital heart disease, and there can be a high arched palate that will be there. Protrusion of the tongue is one of the classical features. Dental anomalies are prone to be there. The medial epicanthic fold is seen and a short nose which has collapsed owing to the weakness of the nasal septum. Slanting eyes and a broad face. Too many of them are there, but then it should not be difficult for you to reproduce. I pertinently read out all these because it is one of the most common short cases in pediatrics. Now look at this one. This is a normal palm in which I am finding a couple of ridges. Whereas here there is a single transverse palmar crease which is called the Simian crease. Karyotyping. What do you mean by the word karyotyping? They arrest the chromosomes of your cell at a particular phase and they arrange it in order and further study the morphology and the G banding of it. This is called karyotyping. And when this is being done, they found that there was an increase in the chromosome 21. That is why it is called as trisomy 21. Cardiac abnormalities are common. Though it is out of context, I had filled in this space. A patent ductus arteriosus is common over here. There are other disorders also wherein you can have a patent ductus arteriosus. Now, what is the pathogenesis? Why do you get 3 chromosomes in 21? It can be because of non-disjunction. So, at one stage, there is a failure of separation and the unseparated couple join a separated chromosome. as a result of which 2 plus 1 you get 3. Translocation. From another chromosome, part of the long arm is shifted onto 21. Therefore, you get 3. Then there is something called as Robertsonian translocation, in which parts of the chromosomes are lost and the others are fused. This is called Robertsonian translocation. It occurs in Downs. But they say that the parts of the chromosomes that are being lost do not cause much of symptoms. And mosaicism is when there is a disjunction along with any of the Robertsonian translocation, etc., as well as the normal chromosomes, you find that there is a play of these, and that is called as mosaicism. Look at this one. There is 3 chromosomes in the circle, and then when they divide, you get 3 each. And one can be lagging behind in the anaphase so that you get 2. And the other one can be dividing into 3. So there is one division into 1 and 2, the other goes in for 3. Whereas in this case, I get 3 and 3. So when I put everything together, I find that the cells are having different numbers of chromosomes, which is called as mosaicism, just like a mosaic flooring. This is a wonderful mnemonic I picked up from the net. I would like you people to kindly memorize. My child has problem. Child has problem. Obviously, that is Downs. And these are the expansions of the mnemonic. Congenital heart disease and cataract, that is there. Hypotonia, hypothyroidism. Increased gap between the first and the second toe. Insecure fifth finger. It has got a tendency to bend and deviate away. L for leukemia, which is more common in Downs, and lung problem, obviously because of the flaccidity of the muscles. Duodenal atresia, delayed development can be there. Hirschsprung's disease, there is a megacolon that can develop. Hearing loss. Alzheimer's disease. Strangely, Alzheimer's is a disease of the old age, but it can occur in Downs also. Squint and a short neck, protruding tongue, palm arteries, round face, rolling eyes or nystagmus. Occipitus flat, oblique fissure is there. And you find that there can be the flat foot. Brush peel spots, that is what I see in the eyes. The ears are low set as well as a low nasal septum causing a collapse of the nose, more flattened. Medial epicanthic fold and mental retardation or myoclonus. So this is the mnemonic for Downs. I would like you people to kindly note this. So this is the Robertsonian translocation. The text is given over here. You people can read it. But let me just explain. So this is one chromosome. And in a chromosome always, there is a point called the centromere. There is a long arm called Q. And the other is P or Petit. Petit is one. So they wanted to name the other. They called it Q. So there is a short arm and a long arm. And here, one part of the chromosome is being lost. I find a long segment as well as a centromere, part of the short segment. And similarly, in another one also, there is a breakage, as a result of which the two long arms fuse together. Since the long arms are fusing together, the properties of both the chromosomes are more or less retained, hence clinical manifestations are unlikely to be there. The small fragment couple is usually lost. So the patient can be having 45 chromosomes in some cells and it can result in mosaicism. Neonatal signs. These can be superimposed onto the other findings, but then when the child is newborn itself, how can you diagnose? The most reliable findings are these: small ears and white space between the first and the second toe. This is called the sandal gap, probably comfortable for wearing the slippers. Small internipple distance, they are more narrow. Brush peel spots, that is what I am seeing in the eye. So these spots are called the brush peel spots. More properly, by proper name, they are called as the Kunkman-Wolfman bodies. Nuchal skin fold. So you find that there is a greater fold of the skin. Reliable and discriminative terms. Most reliable, reliable. Can be brachycephaly. Of course, there are other conditions. Hypotonia, flat face, slanting eyes, and the transverse palmar face of the semian. And age dependent, you find there can be the epicanthic fold. Difficult to differentiate will be the low flat nose because there are so many other conditions, such as a congenital syphilis also where you can get this. Small mouth, of course, is not too very diagnostic. So these are the neonatal signs. Please have this in mind. So if you get it as a question, you people can segregate, score additional marks by this. Please bear in mind, the child is friendly. I can very well appreciate the first picture and this. Fond of music, a strange behavior. Has got thin hair. There are delayed milestones. Alzheimer's can set in, so also leukemia. There can be cardiac problems. All these can shorten the lifespan. Even otherwise, you find that there is a reduction in the lifespan. Counseling is required for the parents. Once there is a child like this, there is a chance of the next one also being a Downs, and hence a counseling is required. Chorionic villus biopsy for an early diagnosis, so that if there is going to be any sign of a Downs, there can be a termination. Karyotyping, of course, is mandatory for a diagnosis. Also, you can have radiographic and echo diagnosis to confirm. So this is one. A cataract. Cataract generally is a disease of the old age or diabetes, but then a cataract is there in Downs, which is called the cerulean cataract. I'm sorry. So you find that a lot of questions can be asked, such as mosaicism, Robertsonian translocation, Alzheimer's, cerulean, semi-increase, so on and so forth. Most people are stronger than they know. They just forget to believe in it sometimes. Kids go. A nice saying, I think it is apt for the class. And there is a foundation over here, Global Down Foundation, which is doing a marvelous job. Whatever be the intention behind it, you find that these are all dedicated services which are worth their weight in gold. Thank you.